Good evening and welcome to the AhaVah Effect, where love leads grounded in authenticity. I'm Candace, CEO and founder of AhaVah Works. I am so happy to be here. So happy that you could join us tonight as we host the amazing and wonderful Tampa Bay Health and Wellness Nursing Group, a group of what seems to be amazing individuals with amazing initiatives who just came and took time to spend time with you, giving you some information about some healthcare tips. Just to give a few disclaimers and disclosures up front, no one here is practicing diagnostically. No one here is giving you information that you should use for treatment. And so we still recommend that you see your healthcare providers, that if you have a mental health crisis, you contact your crisis center. Well, as you know, on the AhaVah Effect, we have a few things that we have to get out the way. So I'll go ahead and do those first, just letting you know that AhaVah is a transformational platform that empowers individuals to challenge limiting beliefs and lead authentically through love, courage, and truth. I am here for all the things positive. Anything negative, we hope to transform that, leading with love and not competition or negativity. Few disclaimers and disclosures. Nothing on this platform represents any corporate entities that we work for. Also, we are not practicing in a practitioner or professional environment. Nothing on the channel is related to any other disclosures or any other corporation. Thank you for that. So now that we have that out the way, I'm going to go ahead and start doing some brief introductions, or actually I will allow these wonderful, amazing women and men to introduce themselves one at a time. And then we are going to get started. As viewers, you know, on AhaVah, the best way to communicate with us is get on your YouTube, get on your Facebook, and drop those comments right under the video. We promise you, we will thank you for being here. We'll entertain all questions and comments as long as they're positive. They do not have any profanity or negativity. And now let's get started.
I will start. My name is Roderick Luckett. I'm a registered nurse, and I'm happy to be here. Thank you for allowing me.
And Miss Williams.
Hi, I'm Bridget Williams, and I am a master's prepared nurse in the senior living space in quality and compliance, and I am happy to be here with you tonight.
Thank you. And Dr. Barnes?
I'm Dr. Lori Barnes. I am a dual doctor at provider for as a nurse practitioner, and my specialties are clinical psychology, psych and mental health.
Thank you for being here. And Miss Martin? I think you're muted, Miss Martin.
She is muted.
I think so. We're going to move on to retired Colonel Horton.
Good evening. My name is Wanda Horton. I'm a retired colonel, registered nurse, and I'm glad to be here.
Wonderful. Thank you for that. Ms. Myers?
Hi, my name is Leila. I'm a BSN prepared nurse working in the ICU field currently, and thank you for having us.
Thank you. Ms. Powell?
Hi, I'm Bridget Powell. I'm a MSN registered nurse, and I'm happy to be here.
Thank you for that. Ms. Jones?
Hi, my name is Dr. Jackie Jones. I'm associate professor at Virginia State University, and I'm excited to be joining my colleagues in this endeavor with Candace. Thank you.
Thank you. And Ms. Matthew?
Hello, I'm Altanisha Matthew. I'm a master's prepared registered nurse and the founder of Altamage Health and Wellness, and I'm excited about the presentation tonight.
Thank you for being here. Ms. Carter?
Hi, good evening. My name is Shanae Carter. I currently practice in the geriatric community. Thank you for having me.
Thank you for being here. Is it Ms. Copels?
Yes, that's correct. Good evening, everyone. My name is Susan Copels. I'm an oncology certified nurse. I work mostly in research and data abstraction. Thank you so much for having us this evening.
Wonderful. Thank you for being here. And I believe we have a couple more. If you give me a second, I'll bring them up on stage. I think, or do we have everyone? Have we gotten to everyone in the room?
No.
Ms. Scott.
Hi, good evening, everyone. My name is Tamika Scott. I am a registered nurse and I work in the space of education with new nurse residents. Thank you for
Okay.
being.
And above all, Ms. Cooper.
Hi, my name is Trishika Cooper. I'm a health and wellness nurse coach, and I am so excited for this group to be here tonight so we can learn all things health and wellness.
Wonderful. So, on AhaVah, we're going to tell you the truth. We're going to give it to you real, and we're going to give a lot of information in a little bit of time. But please also know that everything on AhaVah is interactional. So we would like for you to also come in with us, kind of lean in so that we can go ahead and entertain your questions, your thoughts. I'm going to go further. If you want to congratulate these women for their accolades and men, if you want to understand maybe a little bit more about their journey, if you're even maybe, I don't know, just from seeing their face and hearing their voice, interested in their story, drop your comments because I don't know, ask them one day to be on the platform to tell you what that story might be. As you know, AhaVah is a village concept. None of us have gotten to where we are by ourselves. And on that note, if you give us a couple minutes, I'll go ahead and get things started so that retired Colonel Horton and Miss Layla can get up here and kind of start telling you some of the information that they've prepared for you tonight.
Well, good evening, everyone. As I said, I am retired Colonel Wanda Horton, and I'm a registered nurse. I've been a nurse for over 40 years almost. And I'm going to talk to something that we all kind of know about, which is hypertension. I'm going to discuss an understanding of what high blood pressure is and the risk factors and some of the genetics and why hypertension matters. Before we can control high blood pressure, guys, we will have to first understand what our numbers are. I know people have heard 120 over something. So I will discuss that, what people put at the risk factor and the matters that most families want to know about. Understanding your blood pressure number is very important. Blood pressure is like the force of blood pushing through your blood vessels every time your heart pumps. And an analogy for that is, think about your blood pressure is like a water pipe in your house. And if pressure is too high for too long, eventually what will happen is the pipe becomes damaged, weak, and it get clogged up. So that is an analogy of what blood pressure is. So what is the numbers that we use? You hear people say, what is your blood pressure? We say 120 over 80. Well, that top number is known as, what we know in the medical setting, is your systolic. You might say top number, but in the medical side, is the top number is the systolic number. That measures the pressure when your heart squeezes and pump your blood out to the rest of your body. A simple concept for that will be how hard your heart works when it is beating. That's what that means. And the bottom number you may hear yourself say and people in your family is the diastolic, we say in the medical era. The bottom number measures the pressure when your heart relaxes in between each beat. The resting pressure is between the heartbeat. So when you first hear the first sound, you putting pressure in it, and then you let the air out, and then the pressure relaxes. So you want to know what the relaxed number is in your blood pressure. An easy way that I remember blood pressure is less than 120 over 80 is usually your healthy range. And it kind of works different for different people, whatever your provider might say what your normal would be. And when it started to rise, like 120 over 120 something, when that bottom number is no longer at rest at 80 and the pressure it gets higher, then that's you get in the range that's not too healthy for you. High blood pressure has different stages. You might be at the first stage. You go to your doctor, they take your blood pressure, and they just monitoring your blood pressure. And then as it gets higher, that bottom number and that top number gets higher, then your high blood pressure is increasing, and you have a chance of what we call could be a medical emergency, and you're being diagnosed by your provider for high blood pressure or hypertension. One high reading don't mean that you have blood pressure problems. So you monitor. You might can change your diet. You might can do exercise. You might can lose weight, but you want to keep an eye on that pressure so that you make sure. So normally you might do it weekly or every other day or whatever your doctor recommend. The key point to that is scary about what hypertension is, and the many people feel very completely normal. You don't even know that your blood pressure is high. A lot of people, and you might have heard of the saying is the silent killer, and that's what that means, because you're walking around with this high pressure in your heart and you don't know about it because you feel normal, and that's how it disguises. So that's why it's great to periodically check your blood pressure. If you have something you don't feel well, that's one of the things that you can do. Check your blood pressure and make sure it's good. What high blood pressure can do, if you keep it high, it can affect your heart, it can affect your brain, your kidneys, your eyes, your blood vessels, your blood vessels. So you want to be able to know exactly what that pressure is, so you won't be walking around feeling well. Or you might have a headache, who knows? And you just say it's just a normal headache, or you had it before. It's a good thing to go to your doctor or your provider, get someone to take your blood pressure and make sure you report that. Some of the risk factors. Some risk factors we can control and some we can't. We can't control that we're female or male. You can't control your race. But there are some things you can do. And you probably have heard this many times. People say you use too much salt. A lot of people, everyday food is loaded with so much sodium and food that in your food that you can taste the salt. That's not good. So that's a factor that you want to, not try not to do, not to have too much salt in your diet. And you'll see a lot of that in your fast foods, in your canned foods, because they use it to preserve the your vegetables. Your frozen vegetables are probably the best to do it. But your anything in a can, they have to process it to keep it good until you use it. That's why they can stay in your cabinets for years after year. So those things, potato chips, that's one of my weaknesses. I like potato chips. So you just do it in moderations. And frozen dinners, those things that have to be preserved for a certain amount of time, is full of sodium. And as you go on, you'll learn to read, the back of the ingredients that's in the foods that you're eating. And if you can't pronounce them, it's probably not good for you. But you can look and see how much sodium that you have. And another thing that becomes a risk factor for us is we just sit around, we don't move around. So exercise is a big part of it. So you might go to your doctor and they say your pressure up and they say change your diet, do more exercise. Our bodies were designed to move anyway. So sitting too much affects our heart and our circulation. So you want that circulation moving within your body. Stress is another one. Stress affects more than we ever think of it. And stress could be something good, you're excited, or it could be something bad that you're stressed about, that you want to having problems or situations in your life. Is considered stress, and it affects your body. You can have some financial stress, caregiver stress, work stress, relationship stress, and that job stress. Those things can affect your blood pressure. Smoking and alcohol. These increase your pressure on your blood vessel and the heart over time. So these are some of the things that you can change. You don't have to smoke. You can stop smoking, just like you can decrease the amount of sodium in your diet and do things in moderation. Weight gain. Extra weight means the heart has to work harder to get the blood flowing through your body. So that's why you want to make sure that you checking it because you don't know you feel well, but your blood pressure can still be elevated. Then you have those genetic and family history. Everybody in the family got high blood pressure or diabetes or some other medical concern. Now, those things you can't control, what your family does, but you know that you're at risk for it, and then you can change some of your lifestyle changes. And that goes back to what I said earlier, your food, your exercise, because if hypertension run in your family, then that could be something that you can work on because you know that your chances of getting hypertension is possible because your mama, your daddy, your siblings all have hypertension. A simple way to explain that also, if your parents or any close family member had high blood pressure, that could mean that your chances of getting high blood pressure is higher than maybe another person that you know that nobody in the family has high blood pressure. Doesn't mean they won't get it, but they're more at risk when you have a family history. Genetics is like a loaded gun, but the lifestyle that you decide to pull the trigger on it, then that's when you can make a change, when you know that possibility to happen to you. Another way to understand it is you may inherit it, the tendencies of hypertension, but healthy habits can delay it. That's where you change how you eat, you get up and move around. And nowadays they got so many different things you can use, and you have that cell phone where you can have an app that tells you, because I have an app on my phone that says when I sit too long, it's time to get up and move. So there are different ways that you can do to improve it. Sometimes it can help prevent any complications or getting high blood pressure. In many families, high blood pressure and stroke and diabetes and heart disease affect many generations. So it can come from way up to great, great, great grandmamas all the way down to where you are now in your legacy. Sometimes we think everybody in the family has high blood pressure, so it's normal. Yeah, no, I wouldn't say it's normal, but you can do something to help yourself have a better life or better chance of not having high blood pressure by changing your diet, moving more, and just learning more about what you can do. Is so many things available for us now to know what to choose from. Everybody in social media, you go on there, you search anything, they'll tell you about different things that you can do to help protect yourself. Hypertension is one of the leading causes of people with strokes, heart attacks, kidney failure, and heart failure. And as I said earlier, it's the silent killer. It's called the silent killer because the damage is happening before you even have symptoms. So you could be walking around daily with blood pressure problems, or you don't even know you have a blood pressure problem, and now you're having a stroke. And you were like, I never had blood pressure, but you evidently had it, but you did not know. Hypertension also doesn't just affect your health; it affects your quality of life, because it can make you tired. It becomes expensive now because you got to buy medication. It can lead to kidney failure, so now you're going to dialysis. It can be, of course, disabilities from having a stroke because of your pressure is high, and it can reduce your independence. So it does affect your everyday life. So that's why knowing about hypertension and the things you can do to prevent it, the things that you can look out for, that is important to know, so you will be aware, so you can have a better chance of a better lifestyle. The good news is, guys, is the knowledge that gives you power. So the more you know, the better you'll be at it. And that's how you see that more now, because we have it in so many different platforms and in areas where we can learn more about knowing what our body is. We've heard about hypertension, high blood pressure for many, many years. Just doing like small daily changes in your life can help you, just simple things for prevention. As I probably said already, I'm going to keep reiterating it because it's important. And these are things that you can do to better change your opportunity not to have these lifestyle changes because your pressure was high. We can get up and move more. Like I said, there's an app for that. There's an app for drink, remind you about water, uh, eating better, just choosing the right foods, managing your stress. Take those times where you can just sit and just woosah, uh, or let them. If things bothering you and it doesn't, and you can have control over, just let them, and you can, give yourself a better chance of decreasing your stress. Taking your medication. So if you get medication, you want to take your medication. You say, "Oh, I don't feel bad. My blood pressure now when I take it is good." That's because you're on a medication. So that is not the time to say, "Well, I don't need these pills no more," because you do need the pills, because that's why your pressure is low. It's normal. It's because you are taking the pills. And make sure you get those regular checkups. Once you're on medication, you want to make sure every year you have that physical, so they can do your labs and just monitor it and make sure your body is perfusing blood through the circulating through your body, through your kidneys, so you can be good, so you won't have problem. Knowing your numbers could be literally save your life. So make sure you take an opportunity. They got many different ways now that you can take your own blood pressure. You can buy cups, you can buy things for your wrist. They got different things. So that's a good thing to do, is to have be able to monitor yourself in between you going to the doctor. You cannot fix what you don't control, what you don't monitor. I'm sorry. You can't fix it if you don't monitor. You won't know what to do. High blood pressure may be that silent, but it damages out loud. That go back to the stroke, increasing having opportunities to have heart attacks and those things. And your family history is important, not a life sentence. It is important to know your family history. If your parents or someone has high blood pressure, it's good to know. And protecting your heart starts with small, small choices each day. Choosing the right foods, making sure you exercise, being intentional on the things that you do to protect yourself. So I hope this part of my presentation tells you why hypertension matters. And I'm going to get out of your way and bring up my sister, Layla, to continue the conversation about blood pressure. Thank you, guys.
Well, thank you, Wanda. I really appreciate all the information you just shared with us, because that's a lot of good information that everyone can learn from. My name is Leela Myers. I'm an RN nurse right now at the BSN level, considering going back to school for my master's level, but I'm not sure yet. Blood pressure for me has been something that I've kind of learned through a crash course, not just as a nurse, but also from a personal perspective. I used to say I was born with a double-edged sword. And for me, that meant that my father is Puerto Rican and my mother is African American. And both of those communities are known to have a high level of hypertension and blood pressure. And so for me, it was more important to learn about that so I could help take care of myself and hopefully not pass it on to my children. And then also just be a resource to my family. So as Wanda mentioned, checking the numbers. Right now, we are very fortunate to live in the kind of world where we have devices from the most simplest to the very complex that we can use to help manage those numbers. And I think one of the easiest tools is like to buy like your own personal blood pressure cuff. But the problem is that when we do that, most of them today, they're made for like the wrist. But that's not the place where you're going to get the best result from. It's going to be in your upper arm. And also too, they come with standard sizes. And so when you're buying equipment and using that, you want to make sure you have something that fits properly on your arm, so that by using the right size, it doesn't give you too high of a reading or too low of a reading. And that can also cause stress in itself. Hearing that, you think your numbers are right and then you're doing it incorrectly. So I say when you're looking at things to help you learn how to take your blood pressure, make sure you read the directions on how to use that, because that can take away some of the pressure from that. And then obviously with the way technology is, every phone's got an app for that. And take note of that and record your number, so that when you are talking to your providers, you can keep them abreast of what's going on. They can tweak your care and everything. healthy lifestyles, that's something that I think we all struggle with. I know for me, part of the issue I've always had is that, like, we live in the sun. Well, I live in Florida. We live in a hot state, and it's only really comfortable to get out so much before it gets too hot, like it does in the summertime. But still encourage you to move around. Some of the new ways that I think people can learn to do a healthy lifestyle is maybe incorporate yoga and Pilates, swimming. I know that our community may not always enjoy swimming, but swimming is very, very good for the heart. And also it's a safety measure. So you want to try to think about that. We have a great, the Gulf of Mexico's out there. The water's always bathwater warm in the summertime. And it's just a good thing to do. Bike riding. I know as a kid, that's what I used to do. I used to get out there and just ride my bike. And then now, as much as I would like to, I think I should probably get back into it to get more movement into your body. So just small movements. But if that's not something that people can do right now, whether it's regarding cost, just sitting down and doing like simple chair exercises. All you need to start with is 15, 20, 30 minutes of your time a day to sit down. You can find resources on different types of exercise regimens for free on YouTube. There are many groups that are out there. You can do chair exercises. You can do calisthenics, which is the old school stretching that we used to have back in the day. And more importantly, you want to just make sure that when you're seeking out your care, that you do it within your limits. You want to seek out the proper medical advice and resources, because although we are medical professionals, we're not giving that sound advice like that because we don't want to speak out of turn. One thing I saw in the comments was that someone mentioned about hypertension and pregnancy. That is something that is near and dear to my heart. Hypertension does affect Black women in rates that is unfortunate, and it's very concerning. So if you happen to be a pregnant woman, please make sure that you reach out to your providers and stay abreast of that, because preeclampsia, which is the condition that affects Black women, can be silent and deadly. And we want to keep everyone around for the long haul, especially for those babies. Classes, you can find local resources through your local hospitals, YMCAs, community centers. There are many, many ways that people can find out how to best get in shape and to improve their heart health. And that's what we're really talking about, is heart health. I always tell my patients when I'm at work, without your heart and your lungs, you're not really doing much. So we do want to work to make sure that we're taking those little steps day by day, bit by bit, to try to just get a little bit better. No one's promised tomorrow, but the best thing we can do is just try to make sure we take another step to get to tomorrow. And so that's what I wanted to share with you all. I appreciate this conversation. I'm sure we have more questions in the chat.
Yes, thank you so much to you both. I am full, I'll say that, and I hope our guests are full. From the wealth of knowledge that you gave, both what I like to call laymen, right? I put in the comments back to the audience that I love me a good bag of Doritos. Like, so that's just me being honest, right? Everything and I don't just do like the regular. No, I do like the spicy purple, and it's usually at work, where I shouldn't be eating that in front of patients. But that's me being, transparent, real authentic with y'all. Basically, I think what these ladies are saying is I can have my one bag a week, but maybe not 5. Maybe that's okay. I think that's what they're saying, guys. But we are going to take some of the earlier questions from the chat. I'm going to show one up on the screen from Mindfully Meeks. So pretty, by the way. Very pretty. So Mindfully Meeks asks us, do you find that social media is a good way to have these talks about hypertension with youth? And so we're going to start with the ladies who are presenting. And then if there are others in the group who want to comment on that, I have my own comment after you guys go about that. But what do you ladies think? So question again, do you find that social media is a good way to have these talks about hypertension with youth?
I can answer that. I believe that social media is a tool that right now it's the easiest way to reach the younger audience. I think at our age, we're used to the pen and paper. So for the younger generation, they really lean on that. And I think that that is absolutely a great tool. And I've seen it a lot, like on TikTok and YouTube. So yes, I would agree on that.
Okay, sorry about the echo, guys. I forgot to mute my mic. Let's see. Another one from Mindfully Me. She says, what measures can we probably take to circumvent false information surrounding hypertension and how to cure it? I don't want to speak for you, Mindfully Meeks, but I think I'm going to talk to maybe some things that are out there that may or may not be therapeutic in treating hypertension. What are you ladies' thoughts?
I think some of the this is Wanda. I think some of the stuff that's on the platform will give you information, but you always want to go to your provider. You always want to ask those questions to your doctor or your nurse practitioner. If anything that they will solidify whether or not that information is correct. You always want to follow up, follow through with it, with making sure it's correct. People say stuff, you can just verify it. That's my thing. Trust them, yeah, but always verify it. And that's where you can use your medical professionals.
I would agree with that completely. Seek a medical professional. And this is someone, actually, I really encourage you to go see a primary care provider every year. I know that sounds a bit like what? Of course. No, a lot of people do not. And that is the number one way people find anything wrong with them. Your labs are abnormal and you don't know why, or something happens, or your blood pressure is high and you're like, but I've been fine. I've been having these headaches for 10 years, but no big deal. That's the reason the primary care providers exist, is to kind of try to catch things early enough so they don't become chronic. Other than that, we got a hello everyone from Glam Dolls Boutique. I'll put that up there. Hi, Miss Glam Dolls Boutique. You have any questions for us about hypertension? Let us know. All right. So, ladies, I want to thank you, but I also want to kind of reach out to the group as a whole to find out if anybody else in the wellness group has anything to say about hypertension and maybe wants to come on stage. I'll bring a couple up. Let's bring up Mr. Roderick. Let's bring up Ms. Scott. Any additions to the conversation since we didn't have as many questions today?
Did someone ask something about maternal health?
They asked about pregnancy and hypertension, and then the question was also why, with pregnancy, hypertension affecting Black women at a higher rate, what preventative measures can be taken before, during pregnancy. Mm-hmm.
Yeah, and so we have Dr. Jones. She might be able to speak to that.
Okay, well, let's bring up Dr. Jones to see if she can give us some insight on that. Dr. Jones, Dr. Barnes?
Jackie Jones.
And we are all here. So, Ms. Jones, do you have some insight for us?
Yeah, two things if I can. I want to go back to the one who asked about youth in a platform for social media. And I always believe you meet young people where they are. And this is where they are in platforms, kind of like Ms. Myers said. So to get them where we want them to be is one thing, but we got to go where they live, and they live in social media. So I think that's a great question to ask about our youth, because we do want to engage them in what they think is an old person's disease of hypertension, but there are younger people who do suffer from hypertension as well, based on all the information we got from our panel today. When it comes to pregnancy and hypertension, this is also a passion of mine, like Lila talked about with pregnancy and hypertension, that Black women, 50% are disproportionately affected by hypertension in pregnancy than our white counterparts. And again, it's to the things that our colleagues talked about. It's genetic, it's our diets, it's our style of living. And so we are at a higher risk of acquiring hypertension in pregnancy. The American Heart Association says that 4 or 5% of women, Black women who do become hypertensive in pregnancy, do die from it through complications during pregnancy. One of the things I thought the question asked about was, what can you do? Well, the first thing, if you know you're going to get pregnant or want to get pregnant, and you know you have those familiar things in your family, or you have other comorbidities, is to seek out healthcare prior to your pregnancy so that your provider can start talking about how do you minimize your risk during your pregnancy. one thing a pregnancy does, while it's fun and it's cute, it exacerbates any underlying conditions that you may have. So if you have any underlying conditions, the pregnancy will bring that out, because the baby is sucking everything out of you for its growth. Because you got to remember, you have a new organ that you didn't have before, which is your placenta. And so that organ requires a lot. And so people need to understand that. And it's going to start pulling from you when you don't expect it to. And it's going to need those resources. And so it makes the pressure goes up. And so I encourage women who want to get pregnant to talk to their providers prior to pregnancy. And then once you find out you are pregnant, make sure you get good prenatal care, consistent prenatal care. Midwives are very popular now, and they provide excellent care. I advocate a good midwife is good. Just make sure you seek care. Do all the things the colleagues talked about earlier with the diet, exercise. Those things don't stop because you get pregnant. You want to actually ramp it up so that you can stay healthy during the pregnancy. And again, good dieting, good exercise, keep in touch with your healthcare provider, and that should minimize your risk during pregnancy. And hopefully you will have a normal, healthy pregnancy. Thank you.
Thank you. I did want to also comment on the pregnancy-induced hypertension. I do see that Mindfully Meek, she mentioned that she was one of those Black women that had pregnancy hypertension and preeclampsia, and that it was a life-changing experience. I can also relate. When I got pregnant with my first child, I did not have hypertension prior to at all. And so, and actually my blood pressure ran very low. So unbeknownst to me, I was diagnosed with what we call PIH, or pregnancy-induced hypertension, purely because of me carrying this little one. And again, all the changes that our bodies go through, the increased amount of fluids that are circulating in our body to manage this pregnancy. And so with that, I had lots of fluid, lots of swelling. And I called myself maintaining my eating and, very healthy. However, there are some things that are that are not within our control, right? No matter how much we try to control those things. So I think the best thing, that we can encourage others, Black women in our that are in childbearing age, is to try to be as healthy as possible prior to conceiving, if it's a thought or planned, or even if it's not planned, right? Once you are confirmed with the pregnancy, to try to do as many healthy things as we possibly can to try to ward off some of those things. And then just the understanding as well that hypertension, it could stay with us after we deliver the baby. So again, we want to try to make sure we stay connected to great health care prior to, during, and after we have a baby, especially, if we're diagnosed with something that could definitely change our lives, like pregnancy-induced hypertension. So thank you for sharing. And I wanted to share that as well. But after the baby was born, my blood pressure went way back down to lower than average. So that was a good thing. But thank you for bringing that up and sharing your experience.
Yes, thank you both so much for sharing. And Miss Scott, I didn't even know. And look at that, brought you on stage, ma'am. So I will share, even before I share my own story next weekend, that I was actually, I had eclampsia with my son. I was a teen mom and didn't know what I didn't know, and hid the pregnancy from my parents and all the things. So if you are a teen or a young adult struggling with that on your own, please don't. It could take you out of here trying to bring someone in this world. Please seek health care. Find your local free clinic, whatever you need, so they can check your blood pressure, give you the prenatal vitamins that you need. And if nothing else, find that one person that you can talk to, that you can share with, so that you can stay safe and baby is born healthy. So on that note, we are going to actually transition a little bit, and we are going to leave the hypertension stage a bit. And it's gonna get a little adult in the room, okay? So I have already marketed that this is not a children's platform, and mainly because we are discussing things that are very intentionally for adults, or those at least in early adulthood, and with reason. It is because this platform is to encourage those of us already in adulthood to become better, a better version of ourselves. But more than that, even to encourage each other to be better in life. And on that note, I would like to, I don't know who's watching, so I'm going to introduce to some, maybe represent to others with her dope little slide up here. So I'm from New York, so dope is not, it's not drugs. Okay, it's not drugs. Dope meaning great. That's wonderful. I love that slide. Okay. So I'm going to be quiet now, and I am going to let the wonderful Dr. Lori Barnes come on and talk to us about all the things that she knows and I don't. So, Dr. Barnes, we are ready to hear from you.
Good evening, everybody. I'm Dr. Lori Barnes. I have been prepared as a clinical psychologist, very interesting program, but also as a psychiatric mental health nurse practitioner. I just kind of wrapping that up, and then also as a adult nurse practitioner. So one of the things that us women we go through, is menopause, and guess what it affects? Sex. And this is just not for women, but this is for both men and women to understand and know about, because as we're going through these things, we affect our partners, whoever that may be. So everybody should be educated in this particular realm. So when we talk about perimenopause and menopause, a lot of people, they're like, okay, I'm confused. I don't even know what this is. So perimenopause is a state of a woman's body that starts around the ages of, like, let's say 30 to 40 years old. And so, we go through this time frame where all of our hormones are starting to go down, just like as we age, everything starts going a little bit down. So it's not to wonder that the hormones are going to do this as well. Also, this plays a role with having sex, because if our hormones are starting to go down, guess what? We may not be in the mood for it. So again, perimenopause, 30 to 40 years old. All right. We start seeing estrogen, progesterone, testosterone starts dropping. And when that starts dropping, again, this is what affects our mood. It affects our memory. It affects our body, So there's lots of things that menopause and perimenopause does to us. How do you know? A lot of people say, well, I still don't understand. How do I know if I'm in perimenopause or if I'm in regular menopause? So perimenopause is, again, 30 to 40, right? And you're going to go, this is where our periods are they're all over the place. You might have 1 month where you have a regular, period. And then the next month you might have spotting. And the next month you might have something for 3 days, right? When you have a period that is no more, so consistently for 12 months, okay, 12 months is the magic number. That is when we say that you are in menopause, okay? So it's 12 consistent months. So if you have been 11 months with no period, but on the 12th month you have a period, you're not in menopause yet. You're still in perimenopause, because you have to go the 12 months. Now, what age does that look like right now? So our average age for menopause is about 51 years old, okay? And again, we've got all these different hormones that are going downhill. So how do they affect us? So that's what I wanted to talk about with you today. How does that affect us? So when we talk about estrogen is like one of our lifelines, right? So it helps with our skin, the elasticity of our skin, collagen production, whether we're going to kind of stay hydrated, okay, down below. Now, I'm not talking about our blood, but down below. And then also moods, estrogen starts dropping down, and we're getting depressed, we're getting anxious, we can't sleep at night. I mean, there's all kinds of stuff that happens. Progesterone, that's going to affect our sleep. It's going to affect us whether or not we're calm. It also, again, starts messing with your menstrual cycle when it first starts. Testosterone is the big one. Testosterone is the one that gives us our libido. So guess what? That testosterone drops, and yes, there's testosterone for women, right, as well as men. And men kind of go through their own menopause. So, it's the same thing. As we're aging, we're starting to lose these things. So with the testosterone, when it drops, When it does it for women, guess what? We don't really want to have sex. We don't feel like being touched. Leave me alone. You get mad at, kind of at the world because you don't want to have sex. And then also with the men, it's the same thing. We start seeing erectile dysfunction, things like that. So it's not just the women that go through things. It is both men and women. But with menopause, this is definitely a topic that women, they struggle with. Okay. So one of the things I just wanted to kind of go over with you on this is different kinds of things that you can do to kind of help yourself. Okay. So if we look at the first part of our slide, it talks about hot flashes. That's the number one problem that women have when they're starting to go through perimenopause and menopause. It feels like we've been set on fire. Matter of fact, it feels like someone took gasoline, poured it on us, and set us on fire. Okay. And a lot of the times, and myself included, before I went and got on some hormones, I would literally open up my freezer and go stick half of my body in there. And if I could open up the refrigerator and get the rest of it in, I would, because it's a terrible feeling to have to go through it. Other things that I would do would be like getting a spray bottle and putting some ice water in it, because that was the worst. Just feeling like you're on fire and nothing's kind of helping you. So that ice water in a bottle, you can spray it on yourself, and that does help a little bit. Let's see what else. Dress in layers. So if you're having all these hot flashes, make sure that you're dressing in layers. That way you are not getting, overheated. You can start kind of peeling things off. Avoid triggers. So what's going to be a trigger? Drinking alcohol, because what does alcohol do? It makes the blood flow. Eating anything hot makes the blood flow. Exercising. But we do want to exercise now. I'm just saying that anything that's going to stimulate blood flow could cause a reaction, a trigger for you. Okay. So everybody's body is different. We are going to, as individuals, we're going to look at that and decide what is our trigger versus what is somebody else's trigger, because we have to worry about, what we're going through. So always kind of keep that in mind. But keep yourself a fan close, even one of those portable fans. Keep it charged up and with you at all times. But really, the fan and the water bottle with ice in it is really good. Other things that we have, problems with. You might sit there and have, everything in your brain, and all of a sudden you walk into a room and you're like, wait a minute, what was I coming here for? This is very common during menopause, so a lot of people say, oh my gosh, am I getting Alzheimer's or something? Probably not. It's probably menopause. We always, and I always say, always go to your provider. But, those are some of the things. If we're after the age of 30 and we start, going down the line here, yes, menopause is something that you're going to wind up going through. Again, everybody's body is different. Some people are going to experience things more intensely or more frequently than other people. So please keep that in mind. All right. So with the memory stuff, what can you do? So I am just now starting this. It's starting to use a calendar, like something, a digital calendar that I can say, hey, remember this, or remind me of this, or, if I have to go do something this week, I want to put it up there so I don't forget it. Because again, with all these hormones that kind of, take a downward swoop, we start experiencing things like memory impairment. So we want to go ahead and try to use those calendars and stuff. All right. Next one is going to be our emotions. That's one of the number one things when you talk to spouses, and you'll say, hey, has your wife gone through menopause or perimenopause? Kind of like, how do you feel about that? And the number one thing that we hear is, oh my God, she's all over the place with her emotions. And that may be true because, all the hormones are going up and down. They're starting to drop on us. And so we're going to experience those highs and lows of moods. We're going to probably experience anxiety. Okay. So this is something that, as women, I guess we have to look forward to it, right? So we want to do things that can try to help us minimize this as much as possible. All right. So what can you do to kind of, help you along with this? Take a pause. Okay. Take a pause, take a deep breath, and tell yourself, I can get through this. we can get through this. And, hopefully that you have, and this is another reason why I say that men really should be listening in on topics like this, because they need to know what women will be going through, because that also affects relationships, that also affects sex, it affects everything when it comes down to us and our partners, okay, or us and our spouses, whatever it may be. So it's very important that they understand this. But you want to communicate as much as you possibly can. So having that open dialogue, and also when we talk about things like sex, that has to be part of the conversation too, right? So we have to be open and honest with our partners, because when our bodies are making changes, we have to be able to try to figure out, how we're going to get through this together. Because I don't, if I have a partner or something like that, I don't want my partner deviating because I didn't feel like having sex, or I couldn't stand when someone touched me or something like that. So these are things that you're going to have to talk about with them. And so the more you have open, honest communication, the more you can try to work through things, the more ideas you can try to bring forward. By example, do you need to go see a sex therapist or a counselor or something to kind of help you get through this period? Do we need to start introducing toys into the relationship? Do you need to practice what I call solo play? Okay, solo play is when we're all by ourselves. So what is it that's going to help you get through this? Okay, so again, this is going to be a hot topic for us. As you get older, everybody has to go through it. Okay, so just kind of talking with your partner, be open and honest, and have that open dialogue. Okay. Also, there's going to be changes, physical changes, guys. So without estrogen, progesterone, and testosterone, and all these other hormones that go into our body and make us function on an everyday basis, we're going to lose, like I said, some of that moisture. Okay, I know that's the dirty word, moisture. I'm moist. But we're going to lose it, right? So how do we get this back? What can we do to help us? Lubricant, okay? Water-based or silicone-based lubricant, okay? So you want to kind of check that out. Those are things that you can use. If you are a person, maybe, there could be someone out here watching this right now that says, oh my gosh, I've been going through perimenopause and I haven't had sex in 2 years. Let's say something like that. What do you do? Because if we haven't kind of been using things down here, it's going to be a little bit different when we actually do. So again, this is where we start looking at bringing in toys, either with the partner to kind of get us started, or, solo play. So we just have to see what's going to be best for us. It's all about you. It's all about, our queens in the room. So let's look at the next one. Your sex drive's like Wi-Fi, I said. Strong one day, but gone the next. All right. The next one you say is, you'll forget your password, but remember everything embarrassing at 2:00 in the morning. And that happened in middle school. Okay. So how can we fix this? This is going to be like our sleeping. So again, all these hormones will affect our sleep. So how can we do good sleep hygiene? That's what we call it. Okay. So as a provider, I talk with patients and I say, hey, you're here, you're talking about your sleep is interrupted, disrupted, whatnot. Here's what we need to do. We need a good sleep hygiene plan. Okay. So do you, as a person, do you need to go take a hot shower before you go to the bath or go into the bedroom? Do you need to make sure that your telephones are shut off? Because that blue light on your screens that we love to go ahead and scroll, that causes us to have disrupted sleep. Staying away from some things, again, this is going to go by person to person and not everybody, but cannabis. Some people, cannabis is good for them, and in a small dosage can help them doze off to sleep. And for some people, cannabis is not the right tool to be using. Okay. But again, you have to go by you. Other things that you want to do for good sleep hygiene, dark rooms. Okay. so we can go ahead and turn all the lights off, get the blackout curtains, things like that. So there's no lights, because a lot of lights will disrupt us. Anything, and I mean, even a light on a TV can disrupt us. So we want to make sure that we're cutting off all those lights, things like that. Exercising, if you get up and you start exercising earlier in the day, that kind of wears our body down a little bit, in a good way though. So it kind of might, help us kind of wind down, especially after, a meal. So you get up, go out, take a walk around the block or so after you've eaten. That kind of just helps you it stimulates, but it also kind of helps us wind down too. We get a little tired from it. Making sure that you're eating right. So caffeine, no. We don't want caffeine at nighttime. Why? Number one, because I don't want to be going to the bathroom all night. That's going to disrupt your sleep. But number two, caffeine is a stimulant, right? So if you're drinking coffee, if you're drinking tea, if you're drinking soda, if you're taking the energy drinks, we got to slow down on that, because that again is going to make us want to stay up all night, and it's not really controllable on our part once it's already been consumed. So kind of stay away from it. Put all those things together. Other little things I like to tell people, especially if you have anxiety, if you've got depression or you've got anxiety because you're going through menopause, what you want to go ahead and do is you could always try a weighted blanket. And it goes by your weight, but it can be like 5 pounds, 10 pounds, 15 pounds, 20 pounds. A good weighted blanket. I love those. Sleep masks. They've got sleep masks with Bluetooth in it. I love those. Love, 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 love those. Especially the ones that are made with silk. And they've got the Bluetooth, and they're like $15. You can charge them up. I would always suggest that they're nice and charged up, but you can put in, ocean sounds or, soft music or whatever it is that you like that's good for you. That'll help you go and stay asleep. Because once you get underneath that weighted blanket and you've got those Bluetooth sets on, a lot of times you doze off, and it kind of helps you to continue to stay asleep. Okay. But that's about it. So I just wanted to talk to you guys about that. And I hope you learned a little bit and enjoyed what I had to say. And again, my name is Dr. Barnes, and I hope you guys have a great night.
Dr. Barnes, thank you so much for both your time, for your expertise, for your amazing slide. But also, I just want to thank you for talking about the things, and sometimes in culture, in any culture, but more so our culture, that are taboo, that nobody wants to talk about, nobody really wants to hear about. Sex can be like a bad word, whereas I always felt growing up, the more we knew, probably maybe the better off we would be having these conversations openly. I'm going to bring a few people on stage who may not have gotten to comment yet, and who may want to be part of kind of this discussion. And then I'm going to also take a look at to see kind of what kind of comments we got. We didn't get a whole lot of comments on this particular topic, which I pretty much figured, which is why I told the audience, don't be shy. We have to talk about these things. I will promise you, going forward on the AhaVah Effect, we are going to talk about the things. Not to say, everything that we are all going to agree on certain things, but they definitely need to be discussed. So first comment coming from at Glam's Boutique was that she likely had her first hot flash on Sunday, and it was horrible. Okay. I will say in full transparency, I am not there yet, but I learned a lot today. And I am so happy that I learned what I learned today. So I guess, is there even anybody in the group willing to share their experiences with hot flashes? Yes, you might give away your age. And if you're willing to be that authentic, let us know what happened.
I was going to say, I experience them now. So I keep my AC on 67. It's that way all night. And then even in my own room, I have one of those the big industrial fans almost to try to keep me cool and stuff like that. But I could get up and do limited work, and then all of a sudden you have a hot flash and I'm sweating, my hair is sweating, everything is sweating. And again, that's why I want to go throw myself into the freezer. It is like being kind of like set on fire almost. So yeah, just like I said, getting those bottles of ice water and ice packs. They have the little ones that you can freeze up and it just goes around your neck, and that kind of helps you to cool down. But yeah.
Oh,
Hi.
hi.
Go ahead, Susan.
Oh, okay. I wanted to share that, yes, like I can remember so well when my mom was going through menopause, and we would have the air conditioning on, and she would pull up the kitchen window. And, of course, that didn't really work with everybody else in the house because all the air now is going out. But it was that kind of conversation for her that kind of helped me to understand that it might not happen for me the same way, but it's definitely going to happen. And I can agree with the comment that that very first time can be quite unsettling. I was actually in my office that was pretty small, and someone came in the office to talk to me and got kind of close to me, and all of a sudden my face, my forehead was just sopping wet, and my hair and everything. And of course, at the same time, I was a little bit embarrassed, at that moment. And it occurred to me later that it didn't really even help me to take my jacket off, my lab coat off. I just could not get rid of that moment of hot heat. And I learned after that that I needed to keep the light dim in my office, as well as if I'm having a conversation with someone that's close, we need to do it in a room outside of my office. My office was just too close for that type of reaction, but or interaction. But yes, it's been quite an experience, and you find your way to cope through it. I love the advice about um, making sure you put things on the calendar. I went through a period of making notes to make notes, to make sure that I didn't lose, the things that I really needed to take care of in a timely manner. So there is a way to get through it. Well, thank you.
Hi. I just want to give my experience. I had surgery that put me straight into menopause at 35. So I'm 50 this year. So I've been dealing with menopause for, what is that, 25 years. And it's been a journey for 25 years. I've learned the ins and outs. I've found methods that work when you say about the water. When I have a flash, I know to drink ice water. It cools your body temperature down very quickly. In the beginning, I was working bedside, I would take extra uniforms because I would give report or get report and I'm drenched. I learned that stress was my trigger. And so whenever I start to feel that, I have to bring myself down. So the stress and the anxiety. Someone asked, how do you get your partner to understand? You make them. My husband, I love him dearly. The house is set, and during the day, we compromise. It's set at 74, but at 7:00 p.m., it drops to what, 62. This house is freezing. He walks around with sweatpants, a jacket, we have blankets, and he does not say anything. So you make him understand, or he's going to get the not so nice wife. But I just recently, I would carry a fan, the little folding fan, and I just recently elevated to the portable one, and I have two, just in case the battery dies on one. So that's my story.
I love that. Thank you so much for sharing that. And that was the question I was actually going to pull next. So, Thank you at Alphabet Soup 73 for the question. Also, the a comment from Alphabet Soup 73 was that sometimes like the things that we're talking about today seem too taboo, right? Like nobody really wants to get on and talk about them, or nobody wants to really put their face with the conversation. And so, again, kind of right here toward the ends of our presentation, I'm just going to thank all of you for being super authentic, for, in my opinion, humbly practicing AhaVah, which is basically giving of your time freely, giving of your expertise freely, and just giving without the thought of receipt, except that everyone is educated and informed. So I just want to say that to all of you tonight. So at Glam Dolls Boutique asks, are there any supplements that you would recommend to help minimize the effects of menopause? Is there anybody?
Well, with menopause, we always want to look at like vitamin D and calcium, things like that, because it does have reduction in particular areas, and that in itself can cause anxiety, depression, sleeping issues. So yeah, so I would definitely look at something like that, and it's usually 50 to 1200 for the calcium and 1000 to 2000 for the vitamin D. And then also doing things like getting out of the house, getting sunshine. I mean, these are free, so that way you can, kind of get it through that. But yeah.
This is not crafted in science, but I got put into menopause from chemotherapy, from being a breast cancer survivor, and not interested in the traditional medications. So my oncologist actually recommended vitamin E and primrose oil, and it knocked the heat flashes right out. I had no more issues, and still don't to this day. So the other thing that I would say to women is, because the estrogen levels are dropping, you're prone to lower bone density, which predisposes us to osteoporosis. So we want to make sure that you have your vitamin D, as Lori said, and also getting, for African Americans, we have the blessing of having melanin in our skin. Not to say that we cannot be diagnosed with skin cancer, but unprotected 15 minutes of unprotected sun helps with your vitamin D levels and your bone density. So there's many things that we can do, but the vitamin E and the primrose oil was vital for me. Did not need the standard medications at all.
Well, thank you for that recommendation, Ms. Williams, because I'm going to put that one in my pocket. Appreciate you for that. I am actually going to ask if there is anybody on stage presently who would like to give some background on your group. Having our audience have heard that we presented today on hypertension, the effects of, and some informational things that you can do to avoid it, and then went on to talk about menopause and changes that some have gone through and many of us will go through. Can you guys give us just brief background on the group and some of the things that you may have coming up, community wise, meaning things that people can get engaged in or otherwise, and anyone can speak? I know. So I guess the question being then, do you guys like have any community events that you're going to be doing soon, or anything else that you plan to? I guess I know there's some like volunteerism that you have done. Is there anything that you would kind of like the community to know about, or?
We do have a banquet coming up.
Okay. All right.
That's
And
going to be at Maggiano's.
oh, do you? Okay. And I think, okay, you do. Okay. And so when and where is the banquet?
Roderick, do you want to step in for that one?
And Candace, you can add that back up there, please. The 14 karat, please. That's in reference to the banquet that she's discussing or will be discussing.
Okay, so the slide can be added for viewing. Okay.
Yes, we have a banquet that we're going to have on June 6th at Maggiano's Italian Restaurant, and it will be at 6 p.m.
Okay, and then if the audience wanted to find out more information about this, is there a website or something that they could consider reaching
Yes,
out to someone?
yes, you can go on Eventbrite and search 14 Carat, and the link to participate in the banquet is available there.
Okay.
If I can go ahead and say something really quick, it's very, for those of you who are out in the audience, this is a really important thing that we're going through with this banquet and also our donations for the group, because the money that you all send in, whether it's $1, $5, $10, $100, it doesn't make a difference. Every little thing helps, and it helps us as nurses, as providers, as educators. It helps us get into the community where we need to be at, to help and educate and to help bring people together. So if you can, all of us, we're all asking if you can donate. The tickets for the banquet are $100. That helps put money into the group and then helps us get out there in the community to do these things that you all want to see us doing. So if you can help, please, by all means, please do.
Thank you, Lori.
Yes. Thank you, Lori, and thank you, Roderick. So here at the AhaVah Effect, I always say it takes a village. And here is another part of the village. You've met the ladies on Becoming Intro, and now you have met the amazing Tampa Bay Health and Wellness Nursing Group. So with us tonight, those you cannot see off stage includes about 13 to 14 members, which I've been privileged to have on stage and on the platform. I hope from the invitation that I may be seeing some of these men and women in the future who would want to come in and kind of give you their stories in case you are interested. If you are interested in any particular person that you have either seen or heard tonight, please drop a comment on the YouTube channel, like and subscribe to the AhaVah Effect. I'm also on IG, TikTok, and Facebook. Just understand that everything we do is in love, leading that way, grounded in authenticity. I love y'all. Later.
Candace, before you sign us off, I really and truly would appreciate it if Bridget Powell would come on and talk in reference to our raffles. We're also having raffles at our upcoming event on June the 6th. I put those in at the bottom. So if you don't mind showing those, so that way people will understand that we are also doing a silent auction. I think it's a silent auction. She knows more about that than I do. And I know for a fact she can speak on this because she's the one who's actually doing this. So if you don't mind allowing her to speak on this as well as the other slide, please.
Okay, well, we real authentic. So I guess y'all get y'all sign off after Miss Powell tells us about these raffles, because I see a bag that I might want. So yes,
yes. So we are having a raffle that is available now, and what we're doing is we're offering 3 tickets for $75, but each ticket equates to 6 tickets that you can enter into either the wine lovers basket. You get 4 bottles of wine in a Cooper's Hawk $50 gift card, or you have a basket, which is a medium-sized Tefar bag with the duster. And then we have the big Kahona is a gift card basket, a multitude of different gift cards that's valued over $300. So if you buy today, you get 3 tickets. We call them the golden 14 karat package. And those 3 tickets will become 6 tickets. And you could put them in any basket. You can spread them out, put it in one because you feel like you need that wine. And we're going to do the raffle the day of our banquet. And it will go, the money that we receive will go towards our donation towards our group. We will post the Cash App and Zelle information for that. And if you are not able to attend, we can mail it. So we're very versatile.
Okay, and where will this be posted in case viewers are interested, or how would they get in contact to be able to purchase tickets?
They can email me. I'll give my information, and then we can hook up and I can give them the payment information. But if they want to email me, I will send them out the information.
Okay, so we'll get that information to our viewers after. I'll post it in the description under the video so that you will have access. Looks like we have another slide to advertise as well. I think this is advertising maybe the same thing, just a different slide.
Yeah, we're just very excited about the raffle. So we're trying to appeal to every eye. So this is the same information. It goes into a little bit more detail, but the big takeaway right now is the 3 tickets for $75, because the day of the banquet, that package deal is no longer available.
Okay, and then excuse me, is there a deadline for purchasing tickets? Does it go all the way up to the day of the banquet, or do they have to be purchased before?
We prefer the VIP packages to be purchased before. However, if we close our eyes and turn our head and you come to me the day of the banquet, I'm willing to offer the same deal. We will be selling tickets, I say 11, maybe 10 o'clock, up to 10 o'clock p.m. on Saturday. The raffle itself, the winners will be announced at 10 o'clock. So you have up until 9:59 p.m. to buy tickets.
Okay. And so to our viewers, we will also get you that information if you are both interested in attending the banquet and getting some tickets for this very appealing raffle. I will be sure to give you that information under the link to kind of try to get you that so that you can reach out to the appropriate persons within the group. If you don't have any other questions or anything else to say from our group this evening, I'll just kind of check back in with Ms. Cooper. I think that is mostly it. I'll have to put everything in the comments for the viewers.
Yeah, I also wanted to mention and see if someone could speak on the fundraiser that we're currently doing called Double the Shoe, I want to say, if someone can speak on that. And if so, I want to add the slide to that so everyone can see that, as well as donate to Double the Shoe. Please.
So I can go ahead and talk about that one. So Double the Shoe is basically whatever shoe size that you are, you're going to go ahead and double that. So like me, I'm a size 8. So I would go ahead and double that number. So you would go ahead and do $16 to $24 is what we're asking. But yeah, it's just going to be double your shoe size, and all donations go to our group. And then again, this helps us kind of get out in the community.
All right, so to wrap up, what I will do is I will post this information actually to the AhaVah Effect, to the YouTube channel for those watching in case you're interested. I will also actually get them on my Facebook platform so that we can get that information out to you in more detail. Other than that, we are going to wrap up this evening. We do thank the Tampa Bay Health and Wellness Nursing Group for their time and expertise, for their experience, for their community involvement, for being great. We thank them for everything. And for I think the last time tonight, I will say I love y'all. Later.
Later.
Thank you for having us.
Thank you.
No, you're welcome.